My dear viewers, today we have Dr. Sridevi with us. She is going to share what are the treatment option available and how will you prevent this mainly this iron deficiency anemia. Can you share, doctor?
Sure, thank you. So since it's so common, prevention is better than treatment. So for prevention, as we already know, pregnancy increases the demand. So for all pregnant women, they must take iron, and we suggest, and since the absorption is less, we suggest about, this is a prophylactic when they are not anemic also. So not necessary, only if you're anemic you need to take iron. Since the demand increases, all pregnant women should take iron at least for 100 days. That is 100 milligram of elemental iron at least for 100 days should be taken. And along with iron, we give vitamin C and multivitamins. And also, other than this, we also want to treat the hookworm infestation. So along with that, albendazole can be given. And all the diets rich in iron also should be taken. This is for prevention. And for treatment of iron,
folic acid also.
Yeah, folic acid also should be given as prevention.
500 micrograms.
500 micrograms should be given. Now coming to the treatment depends on the duration of pregnancy. Now coming to pregnancy, anemia and pregnancy, depending on the duration of pregnancy and also depending on the type and the severity.
Yeah.
Because in a late stage, when you don't have enough time, the treatment varies. Whereas that's why we want to detect anemia early so that we have enough time to treat it. So what are the different modalities are with oral iron. So when it's in a mild stage and when in early pregnancy, you can treat it with oral iron. So oral iron, there are many preparations. The commonly used one is the ferrous sulfate, which comes in tablet form, and it comes in 200 milligram. And 60 milligram of elemental iron will be present there. So for a prevention, one tablet is enough. But when it comes to treatment, a minimum of 2 to 3 tablets are needed. And it should be continued, and it's continued even after they deliver. So at least minimum of 3 months after delivery, they should continue taking the iron. Along with that, we take the folic acid also. So this is the oral treatment. Next, you also have when they are not tolerant to oral drugs. Some people may have a few side effects when they are not tolerant, or when the pregnancy is, when you don't have enough time to correct anemia, then you can go for intravenous, or when it's in the moderate stage of anemia, you can go for intravenous iron therapy, where we usually use iron sucrose. We calculate the total dosage requirement of iron, and accordingly we give it that in multiple sources, and it should be done only under the hospital, because sometimes we may any injection or anything should be only under coverage of a doctor with a hospital setup. So any reactions, anything can be treated immediately. So that's about the intravenous iron. And next is about the blood transfusion. So that's given in severe anemia when it's less than 7 grams. Or when you don't have enough time to correct with oral or intravenous, then we give, or when there is an acute blood loss, like for example in a postpartum hemorrhage where there's sudden blood loss, then we go with blood transfusion. And when there is very severe blood loss, that is in decompensated, where even blood transfusion cannot be given, then we go with packed cell transfusion. Yeah. And in very severe cases, then we go for exchange transfusion, which is rarely done, but that also we should be knowing. So these are the various treatment modalities of anemia. Along with this, we should be giving vitamin B12 and folic acid. Like as I already said, the cause also needs to be corrected. So depending on what type of anemia it is.
Yeah, I think now some people they use erythropoietin also.
Yes, yes.
Erythropoietin for the treatment of anemia.
Because erythropoietin helps in the production of red blood cells, so we can also use erythropoietin.
Along with that, they test thyroid factors also. If necessary, thyroxine has to be given. Along with whatever the comorbid or associated condition, they have to be treated too. If there is any infection, something they have to be taken care of. Okay, doctor. Thank you very much.
Thank you.
Thank you.